most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to get out of bed after shoulder, hip, or knee replacement. Now, we're not having you do the same way for each one. Each one we have a little bit of different. But if you had even if you just had not replacement, but if you had surgery on your shoulder, hip, or knee, we're going to go ahead and show you the correct way to do it. So,
even if you had some abdominal surgery where abdominals are weakened as well, this is we're going to have some tips for that.
I would also say even after a stroke, possibly you could possibly use this method.
I concur.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. Also, you're going to want to join us on our social media channels because we're always giving away something. Are we giving away the RENPHO foot massager? See that way back there?
There you go.
That thing is awesome.
Yeah,
put down on there.
Put that down.
Yeah, right there. That thing will massage your feet up. You're going to feel comfort like you wouldn't believe. Go to bobandbrad.com under a giveaway section. You'll find it right there.
You better believe it.
All right, we're first going to show you what happens if you had a shoulder replacement or a shoulder surgery or, like you said, abdominal or maybe a stroke. Go ahead and lay down flat on the bed, Brad.
So the reason I'm wearing this white device is because it's the only way I can, demonstrate.
It doesn't allow you to use your arms.
Right. And
so we were sent this device by a guy who invented it. It's the foot anchor. Real simple device. You just slide it between the mattress and the box spring, or the box spring and the base of the bed, I suppose.
Sure.
And it's got a little flip out thing here. And Brad, want to show how to use it?
So normally I'm going to try to get out and use my leverage, but with this, you flip that out with one foot. You get your foot under there, the top of your foot. And it really gives you a lot of nice leverage just to pull yourself up like that. And you can say I did it without any use of my arms whatsoever. Normally you use more elbow than you're even aware of, unless that shoulder hurts and you say, gee, I really didn't realize I used it that much.
Yeah, and I definitely could see it again with somebody who, after they've had a stroke and they have one arm that they're not able to use.
Precisely.
They're not able to get themselves up in that elbow up position.
Right.
You know, that this would give a little flip. Really well made. I give the guy credit. It's a nice little device. It's reasonably priced. We'll have a link down below.
Sure.
And give it a shot. That's going to work in your
It's one
life.
of those brilliant, simple ideas that works.
Yeah.
So,
well made.
Cheers for him.
Yeah. All right. Next thing. Let's talk about. You can take that off now, Brad. You want to mark this leg as being the leg.
You carry on and all.
All right. So let's talk about a hip and knee replacement. A lot of the things are going to be the same techniques. With the hip, though, generally, quite often, they don't want you to flex above 90 degrees. So this is 90 degree, a right angle here. They don't want you going past this. So you're going to have to keep that in mind when you're doing your getting in and out of bed. When you want to get into bed, which we'll go over first, you really want to get up, make sure you're up high enough in the bed towards the pillow. Because what I've found most often is that people get in right here, then they lay down, and then they need to move up that way.
Which is a whole nother procedure.
Right. So, Brad, why don't you kind of come in? You're going to sit down. This is the involved leg. Now, the first time, I would probably have somebody help you.
Right.
And so that person's going to get down, and you want to make sure that you feel like he feels like the leg is secure. So a lot of times you want to grab underneath like this and on the ankle here. Right. And then when he flips around, you can go ahead and you remember, you got 3 good body parts. I mean, you got the other 2 arms and the other legs, so you can make sure you use them. But it's just basically doing the spin. There's not any magic to it. Let's move over further a little bit, Brad, now. So, all right. So generally, you're going to want to get out of bed with the replacement side out.
Right. So the blue stripe, that's my involved surgical side.
So he needs to get to the edge of the bed. So what he's going to do first is bring this leg up. And this, he can help either use the butt to lift up and help move the leg over, or you can actually take this leg and kind of hook it underneath here and help move that over. There are devices, too, that will help you. If you have a cane, Brad always likes this one. That's a good way to do it.
Yeah, a hook cane sometimes work. It all depends, but you need to get around your foot like this, and then your leg is doing some of the work, but the cane does actually quite a bit of it with your arms.
Yeah, you can do almost all the work with the cane.
Yep, and so you can lift it up there. You can actually do exercises, therapeutic exercises that your therapist may show you with the cane, or Bob has the
leg lifter.
At?
Well, I'm just thinking you digress. Like, all
Uh,
right,
Why,
leg
Bob?
or a dog collar would work,
Right.
wouldn't it?
Yeah, it's just you know, it's got a wire leash in there, but you know, people talk about it.
Yeah, the invisible dog,
Yeah,
right?
there you go.
So you can use this to get to the edge of the bed.
Yeah, this is nice because you don't have to have a lot of grip strength. You can put your wrist in there, and we're gonna get it
Yep.
there.
And then you're going to move your body all the way over to the edge of the bed
Yep.
first,
Oh,
Brad. You're doing it wrong.
oh.
So,
Well, you know, Bob, I haven't
had a hip
knee
replacement?
Yeah, it's easier when you're the therapist telling people.
so
what to
yeah,
do.
now when you get to this point, that's when you start bringing it off the edge.
Yep.
You can also, you know, if you have enough, you can also hook it like this,
Yeah.
and then start. You're going to use your elbows. Get up on your elbows.
Yep.
Like that. There you go.
There
And then
we
you're going
go.
to spin around like that,
Yeah.
under control.
Yeah, that's a good point to use your good leg to control the motion of your sore leg, if there's nobody around to help, especially.
So, you know, once you get to the edge here, you got to be careful here, though, because when you get up with the hip replacement, we don't want you going past 90.
Correct.
So we actually going to go ahead and put that leg forward a little bit and then push up with your arms.
Right.
Or maybe you're going to have the walker here, something to help you, or maybe you need somebody to help you stand up. But do not do the lean forward thing here like
Right.
this.
If it's a total knee replacement, that's not an issue.
That's
but the
fine to
hip
do it, yeah.
replacement, they'll let you know after surgery, and oftentimes, usually beforehand too.
So we'll have links below for the leg lifter, and I don't know if you need to put a cane. People know where to get a cane.
Right.
But
yes.
we'll also put it for the foot anchor, so that if you guys want to check that out, you can.
There you go,
So,
Bob.
all right. Thanks everybody for watching.